In this lodge for almost 2 years, the residents of this dementia home have had to tolerate isolation over infection. The furthest that Ghazali Muhammad has physically been is a garden downstairs, because at 63, he's considered among those at highest risk of complications from COVID-19. But thanks to his new hobby, he can explore beyond his garden and even beyond our borders.
Their social life, their mental health were very, very much affected. A lot of them, in fact, verbalized to us that they want to go out. So we have to quickly come up with something to help to maintain and improve their cognitive health. And so we took a three-pronged approach through technology, bringing the outside in, and to innovation.
The lodge overhauled its programs, providing access to computer devices and a revamped garden where seniors with green thumbs can plant and harvest produce. Areas like corridors have also been repurposed so that residents can reminisce simpler times. Before COVID, the home would bring residents out for activities, but now the outside is brought in. This wall mirror, for example, depicts life in a kampong, where residents can come over to engage with it, even interact with various items like this durian to stimulate their senses and trigger memories. As Singapore's population ages, dementia is becoming more common, typically affecting those aged 60 and above. Around 1 in 10 suffers from the condition, amounting to at least 80,000 people right now. And that's projected to increase to over 150,000 by year 2030.
I like to go out. I like to go to the community center. I like to go there and sing song.
But strict COVID curbs have meant that 83-year-old Peter Lim can't take part in his favorite activity. So the Lim family invested in a home karaoke system. While they're hoping to bring him out for more activities in time, it's an uphill task, showing that the pandemic affects the housebound as much as those living in homes.
Routines get upsetted, get thrown out of whack, and to re-implement these routines, it's not easy. Within these 2 years, Daddy also developed public incontinence. It used to be a 2-hour journey for preparation, but now it can be close up to 4 hours, right? Because we need to make sure that we pack everything. We need to make sure that mobility is still able.
Dementia Singapore has tried to keep its daycare centres open as much as possible. But attendance has dipped by 40% as families keep loved ones at home and away from the risk of contracting COVID-19. And so the Social Service Agency continues its work on the outside. This membership-based app links dementia patients and caregivers with wellness activities for free or at discounted rates. Patients also get a card with a personalized QR code. If they get lost, anyone can scan it to alert their caregiver. Around 1,800 users are on the app so far, with the goal to bump it up to 3,000 by May.
What we're trying to do with this membership is also allow an identification for people with dementia. So that will help. And even like going to a clinic for treatment, if a person with dementia sits in a clinic, doctor's clinic for too long, they can actually get very irritated and then very restless. So we're hoping that even some clinics, they can recognize the membership card and at least give some priority to the person with dementia. Let the person go first.
And it takes a village, so efforts to enhance dementia support are being extended to the wider community. I'm here in Yio Chu Kang, a town in Singapore that will be the first to incorporate dementia-friendly features across all its estates by 2025. One key feature is the colour zoning of blocks, where they're painted in vibrant and different colours so that persons with dementia can easily identify where they're at and to find their way home. More recreational spaces like community gardens will be built too, paving the way for activities just for seniors in a town where 44% of residents are 50 and older.
One initiative that we are trying to push on is having more go-to points in Yio Chu Kang. And these go-to points are really, can be anywhere. It can even be your provision shop here, where the owners or the auntie and uncle there who are manning the shop would know what to do if they meet someone who has dementia. We are able to bring people with dementia back to their homes or to places where they can seek help.
The Agency for Integrated Care is leading efforts to build dementia-friendly communities. Now, on top of Yio Chu Kang, it's working with 13 other towns to reinvent their spaces.
What uncle or akong with dementia wants to do really is to continue to be able to go down to their favorite coffee shop, enjoy their coffee, take a bus, go to the nearby supermarket to do their grocery shopping. With some environmental upgrading and infrastructure, we are able to support persons living with dementia to feel safe, familiar, and continue to live in the neighborhood for as long as possible.
And the agency's not done. It's expanding its plans from neighborhoods to public transport, like in the case of SMRT. It has trained staff deployed at 17 train stations and 5 bus interchanges in case people with dementia need help. It hopes to have such staff stationed along its entire public transport network in time.